For those men suffering from enlarged prostate, your physician is offering the thermatrix therapy, which is a non-surgical treatment for BPH that can be done in your doctor's office without anesthesia in approximately 90 minutes. Offering the latest treatment for enlarged prostate, thermatrix has helped many men improve their quality of life with the TMX 2000 microwave thermotherapy treatment.
I had the treatment done 3 years ago, and since then I have not had a problem that would be involved with BPH at all. No getting up at night, no having to stop during the day to go to the washroom other than normal times. I can make trips without having to stop.
I can go 5, 6, 7 hours, 8 hours. And then when I go to sleep, I'm not waking up every hour, 2 hours to go.
We've been performing thermatrix thermotherapy for over 3 years, and we've been very happy with the results. The vast majority of our patients have had a significant reduction in their urinary symptoms. They've been able to come off the medications that they were taking, and up to this point, all have been very happy with the therapy.
When a patient comes in and says he has an enlarged prostate, what he's feeling is that he cannot fully empty, that he's having problems with dribbling, that he has to stand over the toilet for a long time, and those are the symptoms that he'd like to get rid of.
Having BPH is, it's, you know right away that you have a problem because it gets to the point where you can't urinate at all. And it really does cause some very uncomfortable moments.
I'm in sales, so I would be out during the day, and I would always be looking for a place to have to go to the washroom. And if I would travel a distance, I would have to stop and go to the washroom several times, plus getting up during the night 2 to 3 times was just not good at all.
Enlarged prostate, also known as benign prostatic hyperplasia, or BPH, is a very common condition in men. As a man ages, his prostate enlarges. As the prostate enlarges, it encroaches upon the urethra, causing partial and sometimes nearly complete obstruction of urine flow. This condition is known as enlarged prostate, or BPH.
Once a man has been diagnosed with BPH, he's offered several options. One option is simply observation. He can take a watchful waiting approach and see how his symptoms bother his lifestyle. If his lifestyle is bothered, then the next choice is usually medications, which help many men. When I first evaluated the thermatrix device, I was concerned because I had used other microwave therapies, and I felt that the patient tolerance was not that acceptable. With the thermatrix device, we truly have an office-based procedure that the patient can tolerate in the office without any major medications or sedatives.
This is a great alternative for a lot of our patients. They don't have the side effects or the cost of the medications, and they don't have to go into the hospital to have a surgery. They can come into the office where they feel very comfortable. They know their doctor's there. They're going to be awake through the whole procedure. They're going to know the nurse that's doing the procedure for them and feel very comfortable in the surroundings they're in.
The day of the procedure, most gentlemen will take a few medications at home. All men will take an antibiotic pill, and many of the men will take a sedative, usually about an hour before they arrive in the office. Not all men choose to take a sedative. I leave that up to the patients.
Prior to the treatment, they gave me a pill to relax me, which was fine, but I was wide awake during the entire procedure, listening to some music, talking to Dr. Nizzarello, and just carrying on a regular conversation. It was not a problem at all. It was an easy experience to go through.
They gave me a couple of pills or something, and they started the procedure. And everything was good. I was just laying there, and I was looking at the ceiling and everything. And I think it took about, I don't know, maybe about an hour, and it was over with.
The day of the procedure, I really just showed up at the office. The nurses kind of explained to me what was going to happen. Joe was there, and he pretty well explained the whole procedure and exactly what they were going to do, and about the insertion of the catheter, and the I think it was about 45 minutes with the catheter inserted, and the whole procedure was very simple. It really, there was no pain, nothing that was uncomfortable about it at all. It was just a terrific procedure that worked really well.
After applying a local anesthetic, the urologist will pass a small flexible catheter through the urethra to the bladder, where a small balloon will be inflated to hold the catheter in place. The thermatrix microwave system is rolled up next to the patient, and a microwave cable is connected to the treatment catheter.
Once the catheter is placed in the patient, he will experience maybe some heat in the tip of his penis or in the abdomen. This is very common because we are putting heat to the prostate.
A patented microwave antenna in the catheter then delivers heat to the prostate, causing changes in the prostate that help relieve BPH symptoms. Once the treatment is complete, the doctor will deflate the balloon, remove the catheter, and place another catheter, which the patient will wear for several days.
2 to 3 days after the treatment, the catheter is removed. Many of the patients remove it at their own home, or they come to the office to have it removed. What's been interesting is that initially the patients don't have significant relief of their symptoms. This is because of some swelling that's occurred in the prostate from the treatment. Usually within a month of the therapy, they're noticing a remarkable increase in their urinary flow and are much happier with their symptoms.
A couple days after the treatment, my wife took out the Foley, I was expecting big things real fast, and there was kind of a swelling, and the doctor told me that there would be. But within a week, I had noticed that the first thing I noticed is I didn't get up as many times during the night. And then when I was working, I noticed I didn't have to stop and go to the washroom at all, which was great. And then about a week later, we made a trip down to Indianapolis to visit our daughter, which is about a 4-hour drive. Normally, I would stop 4 or 5 times. I didn't have to stop at all. My wife actually had to stop, and I didn't. It was great.
I have been following my patients for about the last 4 years, and I still keep in contact with them. They said that they're still doing wonderfully. They would do the treatment again if they needed to. They're not having problems. They're not getting up as much at night or at all. Their flow is a lot better. They have a stronger stream. All of the the things that we wanted to happen with this treatment did.
I would recommend it to anybody. I really went through the procedure. I don't know what other procedures are like, so I can't say that much about it. From what I've read, some of the other procedures may take a lot of time with a lot of complications in the background trying to overcome the procedure itself. This one took almost no problem at all. And I would say that the case had been fairly serious before we started with this, and it has come along very, very well. I'm very happy with the procedure.